So, are there key habits or lifestyle changes people can make in their 40s or 50s or beyond that can help to protect the joint and bone health?
Yes, I think there's a few things. I think that there's a discussion about supplements, around joint health, and I think there's probably three that are the most important. Number one is turmeric. I think turmeric is the best natural anti-inflammatory that someone can take. The second thing is fish oil with omega-3, and then which really helps decrease inflammation and maintain the natural kind of environment of the joint. And then collagen powder, collagen powders that people take, enhancing the collagen. Everything is made of collagen, your cartilage, your bones, your ligaments, your tendons. So reinforcing that collagen is very important. I think that maintaining the strength around the joint, like we talked about weight training. For example, I always talk to patients about their quadriceps. If you take 50% of the quadricep muscle away, if you get atrophy of your quadriceps, you get knee pain. Your knee starts hurting. So these are the shock absorbers of your body. If you maintain your core and work on your glutes, you're going to eliminate a lot of your hip pain and also your back pain. You're going to really help maintain the core of your body. So strengthening is really important for joints. And then movement. The physiology, the physiology of the cartilage is that water kind of goes in and out of the cartilage. And as you move a joint, you're compressing the cartilage and water goes in and out. And that natural ebb and flow of water is very healthy. And so if you take a person, I would say, take a person and you put their arm in a cast, their elbow in a cast, and you don't let them move their elbow cartilage will disintegrate because you're not moving the joint. So the movement is really key to help protect. And I think that, there's always a discussion. I mean, I'm sure you get this a lot about impact, running, right? Should I run? Should I not run? I think that running is hard on your body. I think there's people that are physiologically and anatomically immune to breaking down their joints, I think those are the luckiest people alive. But most of us, the rest of us mere mortals, it's probably not great to run. It's probably better to do low impact, biking, swimming, elliptical, weight training, that kind of thing to just maintain your exercise and your fitness.
Yeah, I learned fairly early on, I think it was right after I got my master's degree, that running was not for me. At 6'5", 200 plus pounds, I went
Yeah.
out, I was trying to train for the Pittsburgh Marathon. I went out for a long run, kind of jumped into training a little bit late. I was not too smart in doing this, but went out on a 21-mile run with a couple of friends of mine that were training for the marathon. And I was fine, kept with them. It was a 7.5 minute pace. So I was feeling pretty good about that. I hit
Wow.
mile 16. It was like hitting a wall. And
Oh
for the
yeah.
next few days, it felt like somebody had taken my hip out of the joint, rubbed sandpaper on the head of the femur, and put it back in the acetabulum. And I could hardly walk for days. And it's like, nope, this is not for me.
Yeah,
5Ks are about my limit.
yeah. That's funny. I had a similar experience. I wanted to run a marathon. I was set on it. I did the Big Sur Marathon, which is like, I didn't realize this until I really got involved in it. But the after mile, like, I don't know, 18 or something like that, it's all up and down hills. And I was the same. I ran 20 miles of it, and then at mile 20, my legs were dead, and I could barely make it the last few miles. But I made it. I finished it, but I never ran again after that.
Yeah. Okay, all it takes is a marathon to tell you there's no need to run.
Exactly, exactly.
The collagen I have not done, and I'm a bit skeptical on collagen because
Yeah,
how much of it's digested. It breaks down into amino acids. If I'm getting all my amino acids, is it really necessary?
yeah.
Um,
It's great. It's a great question. I don't think we really know. I think that I know that I personally take I we there's a big the amino acids have become very, very popular now for people taking amino acids for building up their skeletal muscle and maintaining it. And I think that in our world, there's been a huge push of actually using amino acids in the perioperative period. And so I think that, yeah, I don't know actually whether collagen versus just taking amino acids, or should you do both. I don't think the jury's out on that discussion. I do think that taking amino acids or taking collagen or both are helpful, but we're using it a lot now in the perioperative period because we're now giving patients amino acids in a drink, a week before surgery and then 3 weeks after surgery to help maintain muscle mass, to help them build, to help them have a better recovery. And there's some data to say that by taking amino acids, you can actually prevent infection because you're helping maintain kind of the natural nutrients of your body. And so I think you're absolutely right. I think that there's I'm not sure the jury's out with that discussion.
But it's one of those things I think you're not harming yourself and you're just
Correct.
providing the amino acids, whether they're going directly as collagen or not, doesn't matter. You're getting the amino acids. But that's really fascinating about doing it during the operations or around the operations, because
Yeah.
I've never heard that before. And it makes perfect
Yeah.
sense.
Yeah, there's a new, it happened a lot because of some studies with NASA, because they were looking at the astronauts going up into space and losing so much muscle mass because they're in a gravity-free environment. And so NASA worked with some physiologists to help understand what's a good thing for them to take. And it was basically a lot of these complex amino acids. And so some of us in the medical world said, how do we maintain that? How do we use that to help us with patients? And we do that. And also, when you have surgery, you don't eat or drink after midnight. So you think, I tell patients I tell patients this all the time. You come into the surgery and you haven't eaten, you haven't had anything to drink. You're dehydrated. You're hypoglycemic. You're maybe ketotic. You're not in a good physiological state. Then we do surgery on you, and then you go to the recovery room, and now you had surgery at 7 a.m. By the time you're eating, it's like 2 in the afternoon. So there's also work that's being done where people are like you would when you run a marathon, to carbo load. So basically you have amino acids, but then the night before surgery, around like 10 o'clock at night, you have a special carbohydrate drink, something that like maybe you would take if you're running a marathon or you're cycling 50 miles, you would take a carbohydrate kind of thing, have a carbohydrate drink. So you're carbo loading your body to try and get your body to have something inside to help with the natural physiology of your body to help heal.
That's fascinating. I mean, it's
Yeah.
common sense, it would seem, but it's not. It's not what we typically do.
Yeah, exactly. And I think that you're putting your patients kind of, as a term says, behind the eight ball when you're bringing them in and they're getting dehydrated and they feel horrible. I mean, if you don't eat or drink anything for all day long, I mean, some people intermittent fast, but if you fast all day long and you're not even drinking water, you're just getting it through your IV. That's not the natural physiology of your body, and so you're puts you in a bad way. So I think that really working on that, and I think that those principles also as a maintenance is also important. Like if you're trying to maintain your muscle mass and you're not getting enough protein and you're not getting enough amino acids, it's going to be hard to maintain and build and your muscle mass. So I think that spills into life too. And so a lot of our patients say, I'm going to keep taking these amino acids because I want to get stronger, I want to get fit.
Are there specific amino acids that you kind of involve in that period around the operation?
Not really. I mean, I don't know the specific ones that are in it, but there's several different kind of brands that we use that are. There's not one brand that we specifically use, but there's a couple companies that we use that. One of them is Perfect Amino, I think it's called.
Okay, yeah, I've
It's a
heard of that.
brand, that we've been using just because whatever's easy to get, is for the patient, and it's not difficult for them to access it. We use that one for them.
So it's not necessarily a specific compilation of essential amino acids or anything. I'm sure leucine is probably one of the key
Yes.
amino acids
Yeah,
involved.
leucine is definitely in there. I'd have to look at the concoction. I don't know the specific ones, but that it's becoming an important thing. And who knows? Maybe it's something that we should take forever. Like just as even into our late 80s, to help maintain that muscle mass.
Yeah, as I get older, the more I feel like taking some branched chain amino acids on a regular basis, just kind of having that in my hydration drink that I'm drinking throughout the day. Just put
Right.
some branched chain amino acids, creatine in there, and it's really helpful.
Yeah,
So,
exactly. Yeah, I think that's very important, and I do the same. But what I don't know is that should everybody take that? It's like almost like the cardiovascular people say everyone should be on Lipitor. It should be in the drinking water.
yeah,
Maybe I don't know about that, but I think amino acids is definitely something that we should all take.
I'm fighting the whole Lipitor thing. My cholesterol is high, and they're trying to put me on statins. And it's like, no, I'm not going to do the statins because of the detriment it could do to my muscles, and there's all the kind of downsides to it. It's like,
Oh
well, let's
yeah.
look at the lifestyle things that we
Hmm.
can change to improve that. But when you're
Yeah.
talking about improving lifestyle, taking in amino acids is far different than taking a statin, right?
Absolutely, absolutely. Yeah. That's a prescription medication is very different. Yeah, I think, the statins, we see a lot of physiological problems with patients from the statins, the stiffness, body ache. Some people get it so bad they can't move. They're like in bed.
Right.
So it's crazy.
So let's keep on kind of some of these technological advances and things going on in orthopedic medicine. You've been a
Okay.
leader in robotic joint reconstruction. How
Yes.
has that technology changed the game in terms of the outcomes and recovery?
Yeah, great question. You know, it's something that the simple description I describe to patients is that you when you have a map, right? You have a map in your car and you have a paper map and you're trying to figure out where you want to go, as opposed to having Google Maps or like a navigation system in your car. The level of detail that you get is on the highest level. And what robotics has done for us is it's taken the anatomy of the patient, the three-dimensional anatomy of the patient, and allowed us to do the operation before we do the operation. Meaning that a patient comes in and we'll talk about a knee. They get a CAT scan of their knee from their hip all the way to their ankle. So we know the three-dimensional anatomy of their bones. We know the alignment of their entire extremity. And when we take them to surgery, we test their ligaments. We feel where their ligaments are tight, where the ligaments are loose. And remember, your ligaments are different than my ligaments, than different than my wife's ligaments. We all have our own ligaments. We all have a certain bow to our femur. We have a certain alignment of our bone that's all different. But what the robot does is allows us to understand where that is, like how is the bow, your femur has a bow, and how does the end of your thigh bone have a relationship to the rest of the femur? How does the alignment of your whole leg translate into the way you have arthritis and how we want to correct the arthritis? And then balancing the ligaments, making sure the ligaments are balanced. So we test the ligaments, and then we get a set of numbers, and I literally on a computer screen am instructing a person in the operating room to adjust the implant, move it up a millimeter, rotate it a millimeter, move it back and forth, basically positioning the implants to be at the perfect location for that knee to function perfectly. And then when I say, yes, that's perfect, the robot comes in, it knows where the knee is in space, and the robot will cut. I control it, but the robot will cut the bone in the perfect way to accept that implant in the perfect position based on what we decided intraoperatively. So if the technology of that, the advancement of that is so dramatic because now you're considering so many different things you never could understand. And I would say the sad part about the way we used to do a knee replacement is we used to just do the same knee replacement for everybody. We would say the femur should be rotated this much, the tibia should be cut here, and then you would put the sample implant in, and you would have to say, it's not that great. And you would have to cut some of the tissue to accept the implant. Now we put the implant in based on how the tissue behaves. So what happens? We end up cutting less tissue. We end up not damaging, cutting ligaments or doing all these releases that create scar tissue and bleeding. Also, the robot works on a thing called haptic technology. So the saw does not exit the bone. it knows where the bone is. It never leaves the bone. And so when you're doing a manual knee, you can't control where the saw is going. So the saw can inadvertently damage tissues and cut things. And so that makes it very, very minimally invasive. And it gives you a confidence that you can perform that operation at the highest level. So what do we see? We see less bleeding, quicker recovery times as far as getting rid of assisted devices. We see very easy range of motion. My patients will achieve 90 to 100 degrees of flexion in a knee at 2 weeks without a doubt. We never get any issues with stiffness or problems like that. And I have patients of my own that I did a manual knee on and I did a robotic knee on, and I asked every single one of them, what do you think? And they're like, the robot is far easier. I recovered much faster. I had less pain. I took less pain meds. And so we're just seeing a very advanced technique of how we can do this operation on the highest level.
So you've just taken my already high level of respect for orthopedic surgery up to an even higher level.
I'm glad. I'm glad.
Yeah,
You're I'm glad we're educating you. That's fantastic. I love that. Yeah,
that's it.
it's amazing. I mean, it's just like you know exactly where you are at all times. There's no guessing game. Like if someone has a little bone spur in the back of their hip or a little bone loss, or the coolest thing, I think the coolest surgery is, when someone has a pelvic fracture and they have screws and plates in their pelvis and they need a hip replacement. We used to go in there blind. We should just kind of ream and say, oh, if we run into a screw, we'll take it out. But now with the robot, we get a CAT scan of the pelvis and we look at the CAT scan and we say, oh, see this one screw? You just take this one screw out, then you put the acetabular component in and you're done. So you know exactly the screw that's the problem. You're putting it in so perfectly. It is amazing. And we joke about it because we say the x-rays are boring because our x-rays are so perfect every single time. It's just like we used to look at the x-ray and say, the cut's a little off, or this is now it's just like absolutely perfect. It's
It's
great.
amazing. Blowing
Yeah.
me away.
Yeah.
So, what are some of the key advances in orthopedic care that you think every aging adult should know about?
I think some of the key advances are some of the non-surgical stuff. I think that there's a huge world of, I hate to say the term stem cells, because that's a kind of a very broad kind of term that people use. But one of the simplest things that's being used quite frequently in orthopedic practice is platelet-rich plasma.
Mhm.
What that is. It's taking your blood, spinning it down, removing the red blood cells, the white blood cells, and those platelets have growth factors in them. And I think that the biggest thing we see when people age is blood flow, right? The blood supply to your tendons, the blood supply to your joints, the blood supply to your cartilage diminishes. And what platelets do is they have growth factors that part of the growth factors is to stimulate blood flow to the area, angiogenesis. And so I think that that's a common thing used to kind of help tendonitis, help treat inflammation, arthritis. In my practice, if you tear your labrum in your hip and you're in the middle-aged person, you're going to get PRP. If you tear your meniscus, you're going to get PRP. We really try to be non-surgical with these people because those surgeries, sometimes the arthroscopic surgeries, aren't always successful. And so that's a big thing. The other thing that I do frequently is a bone marrow injection. It's kind of similar to PRP, where we take a little bit of bone marrow and we spin that down to concentrate the cells, and we inject that into areas of the body. I usually use bone marrow for people that fail PRP, that kind of don't get a good response from PRP. So, and then there's a lot of technology that's coming down the line. I'm a believer in using your own tissue. I think that when you're taking somebody else's tissue, somebody else's umbilical cord tissue, and somebody else's placental tissue, and you inject it into yourself, we don't know how it's going to react, and probably most of the time your immune system just eats it up. I think that where we're really starting to advance is in you trying to figure out how we can replicate a type of stem cell or control your cells to do certain things. There's an interesting company that I've gotten involved in called Acorn, which is out of Canada, out of Toronto, where they take 50 hairs out of the back of your head, and that they've found that within the follicle there's lots of very immature stem cells, and they want to kind of see that maybe you could pluck your hair and then grow these cells, and then we can modulate these cells to treat arthritis or treat meniscus or treat tendonitis. So I think that that's where the world's going to go. Maybe one day you come to my office and we draw your blood, and we can manipulate the cells of your blood or your bone marrow, or whatever, and try to like get those cells to work in a way to help heal. And I think that's where we're moving towards. But right now, the plasma is really commonly used. And in a day in clinic, I'll do 5 or 6 PRP injections, and we get a lot of great results with it.
So I might be a little too far gone for the hair follicle treatment, but
Oh yeah. We can take it off your face.
okay, well, I'll do that then. I'll save
Exactly.
the beard so that I can save myself down the road.